Hello everyone, my name is Adrian Tapia and I'm going to talk about therapeutic clearance of amyloid by antibodies to serum amyloid P component. Introduction. In systemic amyloidosis, the extracellular deposition of normally soluble plasma proteins as insoluble amyloid fibrils damage the structure and function of tissues and organs. Current treatment consists of support or replacement of failing organs and measures to reduce the abundance of the amyloid fibril precursor protein.
Amyloidosis is the term used to describe a group of diseases in which deposits of an abnormal protein called amyloid form in tissues and organs throughout the body. Proteins are important molecules involved in almost every structure and function within our cells. They are made up of chains of smaller units called amino acids, which fold themselves into three-dimensional structures. Folding allows the protein to work properly and interact with other molecules. In amyloidosis, proteins are made in the normal way, but when they are released from the cell, they open up again. These abnormally folded proteins collect together in long chains or fibrils. The deposits they form are called amyloid. Amyloid fibrils are difficult to break down, and as they accumulate, they start to cause damage. Eventually, the build-up of amyloid fibrils stops the affected tissue from working properly. AL amyloidosis is caused by a bone marrow disorder. The bone marrow produces blood cells, including plasma cells, a type of white blood cell that forms part of the immune system. Plasma cells make antibodies to help fight infection. Each antibody is made up of 4 protein chains, 2 heavy chains and 2 light chains, which attach to each other to form the complete antibody. In AL amyloidosis, the abnormal protein that builds up and causes problems is the antibody light chain, hence the name AL amyloidosis. Instead of attaching to heavy chains, the abnormal light chains open up and bind to other abnormal light chains to form amyloid fibrils. These gradually build up over time. Amyloid light chain fibrils can occur almost anywhere in the body, but the organs most commonly affected include the kidneys, the heart, liver, spleen, nerves, and the digestive system. Treatment for AL amyloidosis involves chemotherapy, steroids, high-dose therapy, and stem cell transplant, and other drugs. Treatment is aimed at reducing the plasma cells to stop further amyloid light chains being made that would otherwise build up in tissues and organs. It also gives the body a chance to break down existing deposits naturally. However, on its own, this process can take many months or years. New treatments which break down the amyloid deposits more quickly are currently being tested in AL amyloidosis. The hope is that they can reduce symptoms and restore function quickly, and in doing so, improve quality of life for patients.
Methods of this study. The researchers conducted an open-label single-dose escalation phase 1 trial involving 15 patients with systemic amyloidosis. After first using CPHPC to deplete circulating SAP, they infused a fully humanized monoclonal IgG1 anti-SAP antibody. Patients with clinical evidence of cardiac involvement were not included for safety reasons. Organ function, inflammatory markers, and amyloid load were monitored.
Amyloidosis is a disease of protein misfolding, where there are abnormal proteins in the bloodstream. These proteins, because they are abnormal...
Well, this is almost the same of the precedent video. Here are the causes of the amyloidosis.
AL amyloidosis is always caused by a group of cells going abnormal in the bone marrow. Having abnormal cells in the bone marrow is very, very common. Over the age of 70, maybe 1 in 10 people, or maybe even 2 in 10 people will have an abnormal bone marrow cell. Usually these are benign. It's a condition called monoclonal gammopathy of uncertain significance, or MGUS. In a very small fraction of these MGUS patients, the protein produced by the MGUS cells has got this peculiar sticky property and cause amyloidosis. In a very small proportion of patients, they may have true cancer of the bone marrow plasma cells called multiple myeloma. So about 10% of patients with AL amyloidosis have true myeloma, and conversely, about 15% of true myeloma patients have AL amyloidosis. The common organs which are affected by amyloidosis tend to be the heart. These patients will present with breathlessness, swelling of their feet, tiredness and fatigue. The kidneys, the urine can become very frothy because it leaks a lot of protein. There can be fluid retention, or the kidney function may become abnormal. The gastrointestinal tract, which can cause change in appetite, weight loss, diarrhea, nausea, vomiting, or occasionally the nerves are involved, which can cause tingling or numbness in the hands or feet, or the so-called autonomic nerves, which supply the blood vessels, can be involved, and there could be dizziness or tiredness or fainting episodes when one stands up suddenly. These organs can be affected either singly or in any particular combination, and therefore the symptoms will be dominated by which organ is most involved, and then by the next organ, and so on and so forth. We almost always need a tissue biopsy for diagnosing amyloidosis, which means we need to take a sample from somewhere, which may be the abdominal fat, the affected organ, bone marrow, which we can look under the microscope and show buildup of amyloid protein deposits. Once we've seen under the microscope that there are buildup of these protein deposits, the next step is to type these protein deposits using specific antibodies, which will tell us what kind of amyloid it is, as we've discussed before. And then we'll do a series of tests for function of various organs. So we'll do an echocardiogram for looking at cardiac function. We'll do a cardiac MRI scan to assess the structure of the heart. We'll do something called as SAP scan, which is a specific scan that is available in a few centers around the world, which can image the amyloid deposits in the internal organs. We can do a PET CT scan, which allows us to assess how the bones are and whether there are abnormal cells lumped anywhere in the bones. And we'll do functional assessments, such as a 6-minute walk test, which tells us what the functional capacity of the patient is. So treatment of amyloidosis composes of 2 very important things.
We're gonna talk about the treatment later. So the results of this study, there were no serious adverse events. Infusion reactions occurred in some of the initial recipients of larger doses of antibody. Reactions were reduced by a slowing the infusion rate for later patients. At 6 weeks, patients who had received a sufficient dose of antibody in relation to their amyloid load had decreased liver stiffness as measured with the use of transition elastography. These patients also had improvements in liver function in association with a substantial reduction in hepatic amyloid load, as shown by means of SAP scintigraphy and measurement of extracellular volume by magnetic resonance imaging. A reduction in kidney amyloid load and shrinkage of an amyloid-laden lymph node were also observed.
So AL amyloidosis can deposit anywhere in the body. The only place where it doesn't cause disease is within the brain. It can affect the soft tissues, which is where you tend to notice easy bruising fragility of the skin, so bruising particularly around the eyes, in the beard line in men. It can infiltrate into the tongue, causing a thickened, stiff, sometimes sore tongue with blood blisters. It can infiltrate into the nails, making them feel fragile. So there's no single test that can look for amyloid or say how bad amyloid is, so we do a number of tests. One of the specialist tests that's done at the London Amyloidosis Centre, and really in very few other places in the world, is the SAP scan. This makes use of a completely normal body protein, serum amyloid P, which will stick to amyloid. We can label it with a radio label and then inject it into people, and after it's settled down, usually for between 6 and 24 hours, we can do a scan and look for where the uptake is, which tells us where amyloid is. The amyloid infiltrates into the heart and makes it stiff, which means that it's difficult for it to fill and then to pump the blood out, and that tends to present with heart failure, causing breathlessness and also accumulation of fluid behind the heart with swollen ankles, sometimes a feeling of abdominal discomfort because the liver's getting a bit swollen. It can also cause low blood pressure from that. When the kidneys are involved in amyloidosis, it can both begin to not work so well as a filter, to start leaking important proteins out into the urine. The early symptom of that is that the urine's very foamy, it's like egg whites. Kidneys can start working less well in terms of cleaning the blood. That's usually noticed on blood tests. That doesn't cause any symptoms till rather late. Eventually, if the kidneys really aren't cleaning the blood at all well, it can cause renal failure and mean that people need help with the kidneys in the form of dialysis. The nerve involvement comes in two sorts. There's autonomic neuropathy, which is damage to the automatic nerves that control automatic functions in the body, like heart rate, blood pressure, gut function, genitourinary function, and that tends to present with symptoms of this not working so well. So low blood pressure when you stand up, sometimes feeling that you're going to faint or actually passing out, disturbances in heart rhythm, sometimes quite bad gut disturbances with alternating diarrhea and constipation. The peripheral nerves are what we much more think of as being nerve function. Those are the nerves that control sensation and also muscle movement. Involvement in that can cause what's called a glove and stocking neuropathy, which is when the long nerves are damaged just by having a little bit of amyloid along their course. Then you can get numbness and tingling in the fingertip.
Discussion. After the depletion of SAP in plasma by CPHPC, administration of a single intravenous dose of up to 650 milligrams of humanized monoclonal IgG1 anti-SAP antibody in patients with systemic amyloidosis produced only transient lower-grade infusional side effects. We observed no adverse effects that were attributable to the formation of soluble SAP anti-SAP immune complexes, the antibody binding to the normal non-amyloid related SAP in the tissues, or to cardiotoxicity. Here we're going to talk about the treatment, immunotherapy treatment.
The aims of treatment for amyloidosis are twofold. First is to achieve a reduction in the light chain protein to normal or as close to normal as possible. And secondly, for this to translate into improvement of symptoms and improvement of organ function. Treatments which are used for amyloidosis are typically drugs which are chemotherapy drugs used in combination to kill the abnormal cells in the bone marrow. Also, for some patients who are fit and fulfill certain very strict criteria, we can use an autologous transplant or a stem cell transplant to achieve the same goal. We always use combinations of drugs because that allows us to use lower doses of individual agents and therefore they cause less side effects, less toxicity. But also because combining the drugs means that we can kill more cells more effectively and achieve these deeper, complete responses that we desire in amyloidosis, which will allow the organ function.